His story is about saving lives. It's about recognizing a crisis, making a call, and finding someone like Harry Monaxa.
You get one cat and they think this is your whole personality now.
He lives in a Bay Area apartment with his cat and cat oven mitts gifted by his parents.
I see, and there's a call.
But over 4-hour shifts,
Crisis support, this is Jack.
he assumes an alias
Are you still there?
and fields calls
Everything that you said is a very valid experience.
from people who need someone to listen.
It's my experience that suicidal folks already know that they want to take this action.
I see.
For 4 years, Monaxa has volunteered for Alameda County's Crisis Support Services.
Just taking care of yourself.
For the past year, the number people dial to reach him has been 988.
988 begins. What happens to your call volume?
It definitely increased.
988 Lifeline.
I've had a lot of calls from teenagers, college students. They are struggling with whatever circumstance they're in alone.
We want them reaching out.
Nargis Zohori Dillon oversees the county service. Last summer, the U.S. changed its Suicide Prevention Lifeline from 10 digits to 3. In year one, contacts nationwide neared 5 million, from chats to texts to especially calls.
What was your increase in call volume?
40%. The move to 988 really, I think, legitimizes help seeking around mental health. If you're having a medical emergency, call 911. If you're having a mental health emergency, call 988.
Let's talk about 911. It's ingrained in our lives, but that wasn't always the case. 911 wasn't enacted until the late 60s, and by the late 80s, only half the country had access to it. Now, it's who you call in an emergency. For 988 to stick, states will likely have to kick in consistent funding at a time when suicide rates in nearly every state are rising.
I think there is this perception of lights and sirens that's most often really not the case, and our counselors are trained to really be there and be patient and caring.
It sounds like you're really in a thankless position. It's not our job to diagnose and course correct for them. That's the job of a professional.
What is your job?
To de-escalate the tenseness of the feeling in the moment, because it's harder for them to make a decision when they're that tense.
Many, like Monaxa, aren't professionals. They're volunteers with rigorous training. Many take calls from home. And many, like Monaxa, know it works because before they handled calls, they made them.
I've personally struggled with thoughts of suicide. And because I went through that very harsh, intense experience of dealing with my mental health, I came out on the other side believing that it's not, that it doesn't have to end there. It really doesn't have to end there.
We agreed not to share the specifics of Monaxa's story. Same for those on this day who call.
Crisis support, this is Jack.
But Monaxa shared his time with us for the same reasons he shares it with them.
Things will just clear. I know you deserve more. What do you think?
It's about saving lives. Through one interview
Take care and we'll talk to you soon, okay?
or 3 digits.
Okay, bye.
That's what we're there for, to empathize.
In Oakland, California, I'm Matt Pearl.